Anytime a veterinarian is out on the farm, ranch, or in the feedlot, they should take the opportunity to spend some time with the people that are actually caring for the animals 365 days a year. For example, if you're at a stocker operation or at a feed yard and they're processing cattle, the veterinarian can spend some time with those processors observing while helping push cattle. That helps them to assess cattle handling and also provides opportunities for training. For example, if somebody's trying to push an animal into a snake and the no-back gate is down so low that the animal views that as an obstacle that they don't want to challenge, you can say, hey, why don't we lift that up, because the last set of cattle we worked weighed 400 pounds and now we're re-implanting some 900-pound cattle. Let's make the facilities fit the size of the animals. At the same time, we can spend time with the processing crew at chute side, and there we can view and address beef quality assurance issues. For example, are injections being given properly? What about chute operations first? Are we running risk of injuring the animal because of the way that we're operating the hydraulic chute? But then observing the beef quality assurance practices and the noise levels and issues like this. And so if we see a deficiency, as a veterinarian, it's our responsibility to be the trainer that day, so we can assess and train all at the same time. That also gives us ideas after spending time there on how we might redirect our training programs. From time to time, it's good to sit down with the crew, whether it's at lunch or late in the afternoon after most of the chores are done, and just talk about what's new in cattle handling, what's new in beef quality assurance, what's new with withdrawal times. We had one of our more important drugs had a big change in the withdrawal time recently, so we can sit down with the crew, tell them why, and that then puts them on board so that they understand why we're doing this. It's also good to show our crews, as we necropsy animals, what those injection lesions look like, because even when given properly and under the skin or subcutaneously, we can see some areas that are inflamed, that can be hemorrhagic looking or have some other discoloration. And this is an opportunity to show the crews why we want them to go subcutaneously. We want it under the skin so that we don't place those products in the muscle where that inflammation will end up being scar tissue, which causes a lot of skin damage and may even be more painful to the animal than given under the skin. Likewise, when animals are pulled in a stocker or feeder operation for some sort of disease problem, there's an opportunity for the veterinarian to go out with those people who are responsible for treating those animals and look at the various clinical signs and discuss why is that animal with respiratory disease, or why is that animal with peritonitis showing this particular sign? What does that mean to the animal? And then it helps us to do a better job of diagnosis and also our follow-up evaluation of the animal. There again, we have an opportunity as veterinarians to work with that crew while they're bringing animals into the facility, going through the facility, operating the chute, taking the temperature, administering the antimicrobials and whatever supportive care is going to be given, so that we can be looking for cattle welfare issues as well as quality assurance issues. And welfare is just part of beef quality assurance. When we're on the ranch, let's say it's in the fall of the year and they gather the cows so that we can preg check cows and wean the calves and do whatever procedures we're going to do to those calves, such as castration and vaccinations and implants and so forth. This again is an opportunity to work with the crew to observe their cattle handling practices, how they bring the cattle in off of pasture into the corrals, how they run them through the working facility, and also spend time at the chute with those people that are administering shots, checking teeth, checking eyes, and then also assessing those animals that have lameness, a poor body condition score, so that we can address not only the current health issues, but the overall welfare practices on that ranch. Cattle care and handling has been a part of the beef industry's mission for as long as I can remember. If we think about things like checking heifers in the middle of the night to make sure that they're not having any problems, and taking hay to cows when there's a storm, and breaking ice in the wintertime, these are all animal husbandry practices that contribute to the welfare of those animals that we own and that we take care of. And the NCBA and the beef industry has worked really hard throughout the years to keep this as a centerpiece in the programs that we put on and take out to the cattlemen. In 2002, we thought it was time to formalize these care and handling practices, and so the working group was put together to develop the care and handling guidelines for beef cattle. This working group was made up of cattle producers from around the United States that represented not only their geographic region, but also they were representing phases of production, whether it was cow-calf, stockers, or feed yard. We also had input from some university staff, and we hired as consultants Dr. Janice Swanson and Dr. Temple Grandin, who are internationally recognized as experts in animal care. And I think this was a good move because this helped develop our credibility. They knew what was important. Our producers knew what was important. Everyone worked together as a team, and the end product was the care and handling guidelines that have been published by the industry and are now utilized in cow-calf, stocker, and feedlot operations across the United States. These were approved by the National Cattlemen's Beef Association in 2003, and since that time we've published these. We've distributed about 200,000 copies of the booklet. There's been many videos made to support the care and handling guidelines. It's been a centerpiece of many cattlemen's meetings and veterinary meetings across the United States for the last 7 or 8 years. The care and handling guidelines are important to cattlemen because it's just the right thing to do. You know, throughout history as animal husbandrymen, we've done the right thing for cattle, whether it's feeding or whether it's health care, it's our breeding programs, forage management. And so we've taken these things very seriously so that we can produce the type of product that the consumer wants, and we can be proud of the way that the animals have been handled during the production cycles. And so if we abuse animals, animals are not going to produce well for us, and it's also not acceptable to the general society today, and it should not be acceptable to us as cattlemen and cattle women. And so these are important because we want to put our best production practices out in front of us, utilize those to produce a product that's one that's desired and it's very wholesome for the consuming public. Each and every veterinarian that works with a cattle producer should be a coach, should be a mentor. They should set the standard. They are part of the management team. The veterinarian has a huge responsibility to ensure that the care and handling guidelines are followed, that we address the welfare issues effectively and on a timely basis. And if we don't do it and do it right ourselves, how do we expect other people to do it right? So again, we have to be the coach, the mentor, and we have to be the leaders in this area so that we can do the best job possible of producing beef for the consumer. And as a result, the general public is going to have a much better impression of how beef is produced in America's farms, ranches, and feed yards.